I know there'll be one or two people late, and I've had a few one apology rather, to say Philippa will be joining us later. So first of all, welcome to members of the committee, and welcome to anybody watching us on the web. This is the Internal Scrutiny Committee of Lancashire County Council, and we're going to be discussing COVID. There'll be presentations from cabinet members and from the Chief Executive, Angie Bridwell. So we'll start the meeting with that, and I'm just going to hand over to Ms. Barr to give us a few house rules. Thank you, Ms. Barr.
Thank you, Chair. Morning, everyone. Just to say that this is the first meeting of the committee using Microsoft Teams, so please bear with us if there's any unforeseen technical difficulties that may be preventing the system from working effectively. We will try and sort them out as soon as we can. We'll obviously aim to keep such difficulties to a minimum, and we do have a technical officer on hand if we do have any problems. So just to go through the general information in the smooth running of the meeting. So as with an ordinary meeting of the committee, presenters will be requested to present their information, and members will then be invited to speak, to ask any questions. Should you wish to ask a question, please use the instant messaging facility or raise your hand through the Teams system, requesting to speak. The Chair and myself will keep an eye on both of them. Members are reminded that the instant messaging facility should only be used for questions or for raising your hand, and should not be used for any private conversations during the meeting. It is important to remember that one person speaks at a given time to avoid any confusion. Please ensure that you unmute your microphone before speaking and that you mute again once you're finished. And please speak slowly and clearly, and just to remind members that you are being watched through the webcast and recorded. Electronic devices are allowed, but please keep them to silent to ensure that it doesn't interrupt the meeting. That's all, Chair.
Thank you very much. Just one thing, if you wish to attract attention, use the raised hand. That would help. I see that Josh has put his hand up already. Josh?
Sorry, Chair, just on that point, I've just had a message from Angie to say she's having some connection issues. She's rebooting her laptop and will join us as soon as possible. Thank you.
Thank you for that. Good. And Josh has done what I was about to say to everybody else. When you've finished speaking, or even when you start speaking, lower your hand. Otherwise, it looks like you want to ask another question. Steve, you've got your hand up.
Only by accident, and just to check that it was working. Thank you.
Okay, fine. Thank you very much. So we're going to have some cabinet members with us today. First of all, we'll have Keith Hidden, who's the deputy leader and also the cabinet member for Highways. Sean Turner, cabinet member for Health and Wellbeing. Graham Gooch, cabinet member for Adult Services, and Philippa, who will be a bit late, Philippa Williamson, and she's the cabinet member for Children, Young People and Schools. And then that presentation, hopefully, if she gets the connection back, will be given by Angie Bridwell, who is the Chief Executive. Stephen Young is with us as well, and he's the Executive Director for Growth, Environment, Transport, Community Services. And we have Josh Myatt, who's with us also. So we'll move on to the first item, which is apologies. Do we have any apologies?
No apologies, Chair.
Okay, so the second item, disclosure of personal pecuniary interest. Anybody wish to disclose anything? No? No? Yeah. Yes, Erica.
I think I've previously made this disclosure when we've been discussing the COVID response, just to note that I'm the leader of Lancaster City Council and thus involved in the COVID response from Lancaster's perspective as well.
Yeah, okay, that's good. Thank you very much. Nobody else? Oh, sorry, David, you've got yours up, David Whip.
In which case, I think I'm obliged to say I'm deputy leader of Pendle Council and I've been lead on COVID-19.
Okay, thank you for that. Is that it now? Good. So disclosure of personal, pecuniary and non-pecuniary interests. No disclosure there. The minutes of the meeting held on the 13th of November.
Move them.
Yes, thank you. They agree.
Second that.
Okay, thank you. The reason I'm struggling is because, as I was explaining at the beginning, I haven't had any mail. This is the third week. So I've got my other laptop on the desk with the agenda printed on it. So I'm reading through that while I'm looking and also trying to do this screen. And the problem is it jumps from one thing to the other very quickly. We've done the minutes. I'm just trying to get the next page up. Right, okay. So the update on Lancashire response to COVID. So with that, I'm just going to introduce, as I said, each cabinet member will give a brief talk. There will be an opportunity to ask a question when that cabinet member is finished speaking. So if you wish to ask a question, you know how to do that with using the chat bar or the hand raised at the top of the screen. So the first one, Deputy Leader and Cabinet Member for Highways and Transport, Keith Idden.
Thank you very much, Chairman. As Deputy Leader, I'd just like to say a few words and then I'll move on to tell you what's been happening in highways. So first of all, members, I think all of you will agree that the public sector is to continue to step up and respond to these unprecedented times in an extraordinary way. Over the course of the pandemic, the public sector, led by the County Council, has performed tasks that seemed unthinkable as recently as a few months ago. Essential work, including but not limited to ensuring PPE is readily available in our care settings, funds being made available to support businesses, vulnerable people being shielded and looked after food-wise, mass testing rolled out across the county, and more recently, the vaccine starting to be administered. Without the diligence and expertise of our staff, this would not have been possible. And this has been undoubtedly improved the lives of many, many people and the residents of Lancashire in immeasurable ways. And for that, I wanted on public record my personal thanks and the thanks to the Cabinet for everything that has been done. Thank you.
Thank you very much.
Okay, so we'll move. Thank you.
Yeah,
So if we can move on now, Chairman, to highways, just a brief update for everybody. I've just a few points to make and I'm quite happy to take questions afterwards. First of all, apart from the first lockdown, all the services have been delivered, and even in the first lockdown, critical activities and eco call-outs were kept going. We did keep a presence there, and we did do the best we could. We were totally locked down at that point. Some working methods have had to change. We've improvised and we've done all sorts of things to keep it going, and we've had lots of good ideas from the staff on how things can be done and keep everybody safe. We've had a few positive cases, which we were bound to have because we've kept going. Some of the larger sites have had to be closed over some periods, but we have brought other teams in and done the best we can. It's been very, very difficult delivering some of the works at times, but I'm pleased to say that we've kept things going. The Fleet Workshop have worked exceptionally hard in keeping all the vehicles out. They work a system now where they're coming in early and they work round the clock to keep all these vehicles going, and they've done a remarkable job doing that. The fleet has also been out and we've got replacements. They've been affected by supplies, but obviously we have new vehicles coming on stream all the time and we're keeping those going. We've lately introduced lateral flow testing into the depots and workshops, and we can identify anybody quickly that has SIP symptoms and make sure that they're looked after and everybody that they're working with. We've been out with all our grit teams, obviously, working around the clock since Christmas. It's been a very, very difficult time this year. We've had a lot of rain, we've had a lot of freezing conditions. It's then rained again and then frozen again, and it does make life very difficult. We've gone through around 70,000 tonnes of grit, and we'll be going through more as it goes on. But as we've always done, whatever it takes, we will keep the roads clear. We've tried as best we can to keep the grit bins topped up. It has been a little bit difficult. Members of the public, unfortunately, do use the grit in a way that perhaps it shouldn't be used. They're soon emptied, and the more grit they put down, the worse it can get. And I'd just like to point out that a little goes a long way, and it does the job. But if you're putting a lot of grit onto areas, they do soon get empties. And when it starts to thaw again, we've got water problems and it freezes, and that is very difficult. But we are doing our best to keep the roads clear, and they've done a remarkable job with it. Our main aim is to keep the main roads open so that people can travel down them, and up to now we have been able to achieve that. And it has been difficult because once a gritter goes out, it has to go back round again because it thaws and then it freezes again, and obviously the salt makes water and that freezes and we have to go around again, unfortunately. We brought in extra gully cleaning wagons. Obviously, we've had heavy rains and we've had great difficulties and flooded areas, as certain parts of the country had. That's been very difficult for us, but we've kept going. We've brought the extra equipment in from contractors to assist, and we're doing the very best we can. Finally, it's worth mentioning that the rain and frost and snow has made driving difficult for all people on the roads. We're aware of that, and we are doing the best. But we do adapt, we do improvise, and we do overcome. And again, I'd like to put it on record, my personal thanks to all the highway staff. Without them, we wouldn't be doing anything. The ambulances wouldn't get anywhere, the fire engines, we wouldn't be able to get to work for our key workers, we wouldn't be able to look after people. And I'm quite happy with the work they've done, and obviously the things they've had to do, which is up and above what they would normally do. And like I say, I'd like it on record, my personal thanks to all those staff. Well done. Thank you.
Thank you very much. Councillor Whip has a question.
Thank you. Just share the thanks to staff for all the efforts that they're making. I've got a question about a test site, but Keith mentioned there about grit and bins and trying to get ambulances through to places. In terms of secondary routes, I had cause to email in about secondary routes, and the response I got was, well, yeah, we did them sort of some time ago, but we haven't been able to get back to them since. And I mean, there are examples where I've got 2 separate care homes on one secondary route, and both care homes got in touch with me and said, look, we're really struggling here, and unfortunately, because bins, the grit bins hadn't been refilled, there wasn't much people could do about it. Now, I don't think that the snow and ice has been confined to my particular patch, but we did seem to get it, or have seemed to got it quite badly. And I wouldn't just wonder whether there's some variation that can be applied where there are particular climatic conditions that require that extra bit of effort being put in. So that's the first thing. In terms of the test site question, and I was quite flabbergasted yesterday, there's a test site, a mobile test unit for COVID-19 in Colne, across Kelton Street, and I got notification through that a half-kilometre exclusion zone had been implemented, preventing any licenses for pavement or road repair works, or putting scaffolding up, for instance, within that half-mile exclusion zone. And I appreciate that the immediate approach to the test site you wouldn't want disturbing, but the half-kilometre zone seemed a bit excessive, and I wonder whether that could be reviewed, please. And if that's going to be the case for all the different mobile test unit sites, I think that will cause considerable problems with people getting on with the ordinary work.
Thank you. David, can you lower your hand now? Thank you. Good. Can you answer those questions?
Yes, I can. Thank you. Yes, David, I do understand what you're saying about secondary routes. Obviously, you will appreciate, and we have talked about this in great detail. When I've been to see you, I've showed me places, and I do understand that in your particular area, it is different. You are higher up, you get the worst of the weather. And I have been looking at this, I assure you, and I did last year. Unfortunately, this year, it has been a very bad time for us with the rain and the frost. Then it rains and freezes again. I like to get secondary routes done. I think it is important. I think that it's important, obviously, people do contact me on a daily basis now with schools, care homes, and different areas that they feel should have a grit bin. And as you know, we have a set criteria that's been laid down. And if you pass that test, that's fine, you get a grit bin. I am looking at this. Obviously, it is important that we try to serve and serve the public and do the best we can. But it's just physically getting round sometimes to do the secondary routes when you're going round 3 times or 24 hours a day to keep the main routes open. But I can assure you, when we do get the chance, the secondary routes are done and the machines go out. Fortunately, there's not been great downfalls of snow, but you do get more snow than anywhere else. And I think in the last day or so you have had snow. But I do take your point in your area, and it's something I am looking at very closely, because geographically you are different. And I appreciate that, to other places in Lancashire, obviously going out towards the coast where we don't have these problems. So I can assure you we're doing that. When it comes to the sites, I wasn't aware of this. I'll be very, very honest. I was fortunate enough yesterday to go because I have a lung complaint and I'm a shielded person, and I've had my jab in my arm, and I'm really thankful for that. And going to the one I went to in Buckshaw Village, just going up to the site, there were cones out saying don't park here, but it wasn't a half-mile exclusion zone, because I went into Buckshaw Village and through it and turned left. And as I turned into where the site was, there are a few buildings there. I can appreciate, like you, that that's what we would do, but I will look at why we're calling off a half-mile area, which I do agree. It does seem excessive. I will agree with that.
Just to say, Chairman, it's not corned off. It's an exclusion zone for people applying to do work in the highway.
Okay.
So,
yeah.
or put scaffolding up and things like that. It's not physically corned off. I don't think there's enough cones in the country.
Sorry. That was my fault. Obviously, I didn't understand what you meant. But if you could let me take that away, Councillor Whip, I will look at this and I will talk with the head of highways about it. That's no problem.
Thank you very much. Okay, the next cabinet member to speak is Sean Turner. Sean?
Yeah, thank you, Chair, and good morning, everybody. And I think I'll start by, I know Keith has already mentioned this, but I think a real big thank you to all the staff. I don't think any of us could have predicted what was coming last year, and that it was going to go on this long and be this deep and impactful. So I know that people have really stepped up and gone above and beyond. My public health team have been absolutely stretched, but really resilient as well, and a splendid effort, to be fair. It's been a case of limited choices in terms of decision making, in that all those choices have been bad ones. It's just about choosing the least bad one, so it's been really, really difficult. But here we are. David, I think I'll just go through quickly where we are in terms of the epidemiology currently. So we are at a point where cases are plateauing, in some areas going down, but not everywhere, it has to be said. Particularly young people are affected or infected, which is it's at the highest point that it has been through the pandemic in terms of young people infections. In some areas, that's close to 1,000 per 100,000. So as you can see, it's still pretty serious stuff. But as I say, there are signs of plateauing. Whether this plateau, it looks likely to continue as a plateau rather than a sharp downward trend. So that's the first thing to say. Main areas of exposure are in healthcare, obviously, shops and workplaces. Around half we think are seems to be the new variant, so that's one thing to take away. The things that remain relevant is that people follow the rules, and in light of all this this sort of data, and it has to be said, generally people are in the main they are, but we are probably hearing about more people getting fined and one thing and another. That doesn't mean people are wantonly abandoning the rules, but there has been a firmer line taken on enforcement. So that's why we're hearing a bit more about that. So the police are definitely being firmer. So we've got testing in place. We've got vaccination coming out. The big race is seems to be the vaccine versus infection. In terms of vaccines, which I'll quickly talk about, which is being administered by the NHS, but heavily helped and facilitated by local authorities who are pulling out all the stops where they can. We're doing, this is across the Northwest, between 6,000 and 9,000 per day. At the moment in Lancs, we've done 155,000. There's 4 ways this is being administered: through primary care networks, which are clusters of GP surgeries working collaboratively. Community pharmacies have come online, but heavily involved with local GPs to give it that sort of familiarity to people using it. Then we've got absolutely every hospital trust in the county that's administering the vaccine, including the likes of Lancashire South Cumbria Care Foundation Trust and Chorley Hospital, for example. So, you know, it is everywhere in terms of hospitals, and also now, as you will all have heard, mass vaccination has begun. It started at the Crypt on Monday in Blackburn. Next week we've got the town hall at Lancaster coming on, so that's good news, and the Winter Gardens in Blackpool, and sometime in early February we will be seeing Preston Burnley coming online, as well as you know, in between that time, a couple coming on in South Cumbria, which, as you know, is the health footprint. Early to mid-March, it's predicted we'll have all over 50s done, which is really good. Lancashire is performing well in terms of getting the vaccine out. It's ahead of its peers locally in Liverpool, Cheshire, etc. We think that all care homes will be completed by this weekend, by Sunday, except for those where there's outbreaks, or obviously we're having to put special measures in place, but they will be attended to as soon as possible. But generally, rule of thumb, Sunday we should have care homes finished, which is really, really good news, and ahead of schedule. Moving on to testing, we're currently testing 24,000 a week in Lancashire. We have, each district has got a site, but there's certain districts. So Burnley's got 3. And we're looking at extra sites. There's West Lancs, Pendle and Ribble Valley, with the 4 new sites, including one in Burnley and extra in Burnley. Over the next week or so, we'll be looking at the other districts to get the sites in there as well to really roll this out. Up to now, testing has been the mass testing. As you'll know, in Liverpool, they were doing sort of random asymptomatic testing. They were hitting about 0.5% positivity. We've been hitting more or less 2, because our model's different in that we decided to target. So we were targeting at first big employers and areas where we thought we might find it, and it seems to have paid those dividends because we have been finding it. And now also we're rolling out to smaller employers and trying to widen that net a little bit, and also with a view to rolling that out further going forward. We've had in helping us do that, we got the military support, as we'll know, which came just before Christmas. Then there was a break over Christmas. There was a break in testing, break in vaccine at that point, that got going again in early January. We had 40 military teams to start with, and now we've got 20, although we've applied to keep those longer because they were due to disappear the first week. I think it was about the 6th of February. So we've applied to keep some of that military support further, but we obviously that will come at a cost, but we think we can cover that, and we think it'd be really useful. What the military have done, they helped us get it going. The logistics, as we know, is their speciality, but what they've been doing more latterly is upskilling people to carry out this program, this testing program, and we're rapidly at the moment trying to recruit people to step into that space. I'm just looking positive rates for 20-25-year-olds. Yeah, we're trying to understand that because, as you say, that's I mentioned at the top of this that this is a big issue with young people. We're trying to target that as well. So the strategy has been different, as I say, from those that you will have heard about in Liverpool and in Manchester, and it does seem to be paying the dividends in terms of finding those positive tests. So that's about where we are. I'm just checking I've not missed anything. Well, it'd be remiss of me not to say Blackburn are hitting 3.4% in terms of positivity. So they obviously getting those results too, and we're inextricably linked, as we know. I'll just, I suppose, mention hospitals. It remains, pressure remains intense at the moment. There is that lag, as we know, between positive testing and hospital admissions. That remains, like I say, a big pressure point, and because of the shared capacity amongst hospital trusts across Lancashire, it's something that binds us all together. So yeah, we keep going, and you know, hopefully we're getting that a little bit nearer. We're told that by September, government are saying that everybody will be generally vaccinated who needs to be. However, in Lancashire, we think we'll be ahead of that. So that's also good news. So I'll leave it there, Chair, and take any questions.
Thank you. Well, I have two councillors indicated. First of all, Councillor Holgate. Steve, go ahead.
Thank you, Chairman. First of all, I'd like to say how appreciative everybody must be with regards to the performance that's been put together in terms of delivering the vaccines into people's arms, and I think that's predominantly down to good local working, collaborative across authorities and different organisations, and clearly looking at the stats nationally, we're at about 70-odd% covering that first cohort of people that are most vulnerable, and I think that is absolutely commendable. But I think there is also a reality check in as much as those areas that of the country that haven't performed to, or for one reason or another, are still down at 40 and 50% of the first cohort being vaccinated. Clearly, looking at it from a strategic national objective, they must also now be receiving more vaccines than we are. We are almost victims of our own success in that regard. But I think it's important that if we're going to see a tailing off of that amazing start that we've made, because vaccines are being directed to other areas of the country that need to catch up, which is absolutely the right thing to do, obviously. I think our public need to know that that's the case, so that there's no false expectations, and we can understand the reasons why perhaps there may be a slowdown. And I could be wrong, and maybe there isn't going to be a slowdown, and we're going to pile ahead as we have been doing and making significant progress. But I just wondered if you, Sean, or Angie, could give us an insight into because clearly nationwide there isn't enough vaccine to go around yet, and there's been slight interruptions in the ways in which people are producing the vaccine and their methodology within the factories. So a bit of detail in that regard would be really appreciated, not just by me, but I think by everybody out there. Thank you.
Thank you, Councillor Holgate. Sean, do you want to answer that?
Yeah, thanks, Steve. I would agree. Collaborative working has been very good. You talk not just within, between us and NHS partners and voluntary sector partners who've been standing up sites as well for testing and things, but also between authorities. We know we are this bowl of spaghetti in terms of governance across Lancashire. We've got all the districts and upper tier authorities, but we've worked it's been a breath of fresh air actually, and we have worked really well together. Yeah, initially I think we had our usual gripes, but we all realised that this was a big issue, and So it's good that you've noted that, because that has really been the case. Yeah, there are some issues that have been mooted about vaccine supply. However, I don't see us becoming a victim of our own success. I mean, this vaccine is being rolled out. If you're seen as being ready to get that out, and which we are standing ready, then what they don't want to do is give it to places that aren't quite ready, haven't got the logistics in place, because you don't want to waste this vaccine. One of the other positives out of the Pfizer vaccine is, and you'll know about all the storage problems with it, what was the number of doses that were predicted to come out of each batch are actually more than what is, what was said that would come out. So that's been a positive in that sense. I've asked about this being a fly in the ointment, vaccine supply, and the lady leading up from the NHS has said she can only see this getting better. Yes, we're sort of on the edge, but we're running it tight, but we're running it. But that this should improve going forward. Now, I've not heard anything to the contrary yet. It is something there on the horizon that we're keeping an eye on, but at the moment, it's not holding us back, and certainly us doing well isn't holding us back, because we're showing that we can use that vaccine when it comes in. Thank you.
Thank you. Councillor Webb.
Thank you, appreciate that.
Thank
Yes.
you. I think pursuing the issue of vaccine supply, and I mean, I know well what's happening with the primary care networks in my own borough. The problems with supply is that the stop-start and unpredictable. They're uncertain as to when the next set of vaccines are going to come in. So there's issues. I mean, immediate short term is booking appointments, which have to be done on a very tight schedule, but they've overcome that. The more long-lasting harm from that stop-start supply is the impact on the primary care services. So routine things like cervical smears, clinics for cardiac clinics, diabetes clinics have been shelved. The primary care staff, the GP surgery staff, actually have downtime when there's no vaccine available for them to be putting into people's arms. They could actually be doing some of these clinics if there was a program of delivery, so that they knew, for the following 2 weeks. And then linked to that is a question really about the tension between the mass vaccination centres and the primary care networks, because it appears to me that the mass vaccination centres are going to suck up the available vaccine. Now, for people on the doorstep of the mass vaccination centres, no problem. But for people who are living 3/4 of an hour travel away, which is certainly the case in my neck of the woods, there's an inequity in the access to get the vaccine. Can we get that equity between the delivery in the more local centres and the mass vaccination centres? I think there's a real problem in the offing there, that we're going to see people's access denied really because of that. And then 2 further questions about vaccinations. What are we doing about vulnerable homeless people, where there was a pilot in Oldham that they got told off for, but it seems to me that we ought really to be having a big push on registering people and getting folk who are homeless and vulnerable vaccinated. And then I'm aware of supported housing staff and whether they get any status within the vaccination priorities, because they too are quite vulnerable because of the settings that they're working in. And on a different tack, sorry about this, Sean, the hospital discharges, there's a new term that I've seen bandied about now for what used to be called bed blocking. I'm not going to use the word bed blocking, but I just have. How, as a social care authority, are we coping with that transfer? And in terms of integrated care pathways, how well are we seeing people coming out of hospital? I mean, either home or into care settings, so that the capacity within hospitals is eased as much as ever possible. Thank you very much.
Sure.
Yeah, no, thank you, David. Impact on primary care services, yeah. Diabetes clinics, asthma clinics have been stepped down, as you say. And again, I'll just go back to, yes, we are running that vaccine type, but primary care networks are a really vital part of delivering this vaccine, and they'll remain so even with the mass testing sites. They are key to a lot of this. It is what it is in terms of any downtime. I'm aware that that's being monitored, and the idea to get the flow of vaccines coming in so that people aren't, I wouldn't say twiddling the thumbs, but aren't being directed away from other stuff. It's definitely there, being looked at, and hopefully we're going to be going forward with a much better supply. I've not heard anything to the contrary yet, but obviously it's being monitored. So that's the first thing. Homeless people, I am totally aware that our public health team have been compiling that very list. Those involved with substance misuse, homeless, and people who care for these people have been compiled onto a list that's been pushed by us to get these vaccinated. So I know that's definitely work in progress. Hospital discharges. Now, while Graham might want to talk a little bit more about this, I'm aware that there's a heck of a lot of work going on in a very integrated way. So a lot of discussion between our adult social care team and hospitals. Home first being the key. In terms of that's where people want to be, and that's where they're going to be better off. So yes, a lot of work about that, and really refreshing stuff that's been forced upon us, I suppose, because of the pandemic, and the sort of stuff really we should have been doing more of before. And it's sad that it's almost sad that it's taken us to get to this to do this work. But all of those things are definite considerations that are, well, not just considerations, things that are happening, and in terms of consideration, stuff around the tightness of the vaccine and impacting on primary care services is definitely something that's being looked at. Hopefully, there won't be a tap turned off with the vaccine. That doesn't seem to be the case, but obviously we've got to be ready if that sort of happens. But at the moment, that's where we are.
Thank you. Graham, can you take the last part of the question? Thank you.
Can I take it as part of my presentation, please?
Yeah, I'm sure you can. And Councillor Lewis, I lowered your hand because you said you're happy to wait until the Chief Executive speaks. Is that still the case?
Yes, thank you, Mr. Chairman.
Okay, thank you. So we now move on to County Councillor Gooch, who is the portfolio holder for adult social care. Thank you, Graham.
Yes, good morning, everybody. I'd like to echo the other Cabinet members' thanks to all the staff that have been involved in delivering the adult service care, not just from my own portfolio area, but also all the other parts of the County Council and Borough Council have weighed in to help, and the tens of thousands, literally tens of thousands people in the community who are caring for people in the care homes, domiciliary care, and informal carers who are looking after people. Anyway, Chair, I'd like to thank you for inviting me to your meeting, and I will take a few minutes of your time, if I may, to address some of the issues and concerns regarding my portfolio that were raised at your last meeting, and to tell you what we've been up to since then. I was in the autumn appointed to the North West Adult Care Services Commission, which was organised and run by ADAS and North West employers. It was all members, adult services portfolio holders from local authorities around the North West, and to swap ideas and to listen to people. Now, to establish how our services were affecting the users in these circumstances, and perhaps more importantly, to see if what we were providing is what they actually wanted. I always have this feeling that care is being done to people rather than with or for them. So anyway, we interviewed a lot of people, service users, their relatives, advocates, representative organisations. The evidence was collected, collated and analysed, and is in a report that you can see, the Commission report, which is on the ADAS website. Now, each member was asked to take forward one aspect of the report, and I took up the issue of visits to care homes, which was a concern that was raised at your last meeting. And you may wish to hear what we've done about visits to care homes. Now, as the first lockdown ended and spring turned to summer, restrictions eased. Families were able to visit residents in the gardens of care homes. Now, that could not last. As I should say, as the leaves of autumn fell, it became too cold for outdoor meetings, particularly in Pendle, and the cases of COVID were on the rise substantially. Now, we were aware that ongoing deprivation of face-to-face contact with people is likely to have a detrimental impact on those in care. It was also tremendously distressing for family members, and they were acutely aware of how separation can contribute to the accelerated demise and lack of cognitive function. Now, it's a harsh reality, but the vast majority of those who move into care homes do so in their last years and on a permanent basis. And it's vital that we did all we could to maximise the personal contact with family. Now, in Lancashire, as in other parts of the country, creative measures were put in place across care settings to maintain family contact. There was introduction of Skype, telephone and other digital contact. Now, whilst this had much to commend it, and it was recommended where visits were not a safe or suitable option, they were not a sustainable remedy or ideal for people with dementia, visual impairment or at end of life. Now, increased restrictions due to the exponential rise in COVID cases, coupled with the ongoing winter, had an increased ban on face-to-face contact, and harm could be irreparable and not feel humane. Well, then there were some competing demands. There was significant concern that deprivation of face-to-face contact is not only impactful on health and well-being, but also contravenes the rights of the individual, and is, as a consequence, and was being challenged by organisations like Amnesty International and other human rights groups. And we heard a witness on the Commission coming up with just those points. Now, we recognise that was an inherent risk that imposing a blanket restriction, there may have been an infringement of someone's human rights. Now, it is essential to consider cases on an individual basis and clarify what is in their best interest if they don't have capacity to make their own decision. Now, as the disease became more widespread, we had to find another way. A task and finish group was set up to report to the LRF on recommendations on visiting guidance for homes, and a very comprehensive report was produced. Now, after then consulting with the care sector, Age UK, Alzheimer's Society, we decided that the only way available at the time was to form cordon sanitaire between residents and visitors. We considered designated visiting rooms equipped solely for the purpose of visits, which could be cleaned before and after the visit. Installation of perspex screens which separate the visitor from the resident, but at least enable them both to be in the same room, albeit through a barrier. Scheduled time-limited appointments rather than just unannounced visits to make things manageable. Clinical grade PPE for those visiting and those supervising, and any other appropriate measures taking into account the individual situation and the setting. Now, all these measures had to be accompanied by a risk assessment of the venue, the visit and the individual in accordance with normal health and safety working practices, and held on site. The copies there for all to see. Now, this had to be the responsibility of the care provider, However, support and advice was always available from the NHS or from the LCC. Now, we decided that all our own council-owned care homes would be equipped in this way, and by leading from our own experience, we could better advise other providers. Some national organisations would determine their own way forward in response to these pressures, but we recognise it would be difficult for some of the small private care home buildings. They weren't really suitable. There was clearly going to be additional costs associated with putting these measures into practice, not only the cost of construction work, but also the extra staff time to supervise the visits and the extra PPE. Now, we received the government's infection control fund allocated to upper tier authorities, and besides passing on the mandatory allocation of the grant to care homes, we also allocated a further £2.2 million of the discretionary element specifically to care homes to facilitate visits. This was to fund the installation of various measures in our own council homes and to make a sizable contribution to the costs for private sector homes. All the LCC care homes had their installations completed and were all running with visits before Christmas. It was a mixed picture in the private homes. Some had progressed and even got ahead of us. Some had buildings that were unsuitable and some could not progress because of the difficulties with insurance. And I note that the latest government advice states, and I quote, "The care home manager must ensure that the care home is operating within the margin of its organisation's indemnity insurance." So no insurance cover, no visit. That is very sad. And I would like to see care homes indemnified by the government. Now, once testing was underway back in the autumn, government advice changed, and its guidance published on the 2nd of September was saying that with lateral flow testing in place, we follow the government's advice and advise care homes that where a visitor had a negative test, was wearing PPE and followed other infection control measures, then it may be possible for visitors to have physical contact with their loved ones, such as providing personal care, holding hands and a hug, although contact should be limited to reduce the risk of transmission and would generally be increased by very close contact. We did emphasise that if PPP was inadequate or failed due to poor compliance, there would be a risk of transmission and serious complications. That and a lot more guidance was sent out to care homes, and there was hope that this would ease the problems, heartaches and distress caused by keeping relatives and their friends apart from their loved ones. Now, this advice was published on the 16th of September and unfortunately had a very short shelf life. Back to lockdown. Now, since the lockdown, there's been no clearance of visits on the basis of relatives having been tested and found negatives. There'll be outdoor meetings, socially distanced, but we are basically back to where we were with our barrier method, which is still valid and still operating. Now, extra visits are allowed in exceptional circumstances, and it's generally been accepted that that means end of life. However, it's getting more complicated because the definition from government has become wider than expected. The latest government guidance defines end of life as, quote, "End of life care for residents in care homes means early identifications of those who are in their last year of life." Now, I don't quite know how that prognosis can be made, but there we are. And as the average life expectancy in a care home is just over 2 years, this puts about 40% of residences in that category, but we don't know which 40%. The guidance goes on saying planning these visit arrangements should proceed on the assumption that visits are enabled in the final months and weeks of life, not just the final days and hours. This is a huge difference, and we're going to have to look into this very carefully. On the discharges from hospital, yes, the bed blocking, which became DTOC and is now back to discharges. We've moved a very long way since the last meeting, and the procedures and the rules for discharging people from hospital into care homes are clearly laid down. Well, they're laid down. I'm not sure quite how clear, but they are laid down. The difference now is that patients are not being discharged without being tested. Patients with COVID are being discharged to care homes, but now we know who they are and they are only going to designated homes where they are expected and can be looked after safely. Now, we have a number of designated homes and we do have vacancies, so there are places there to go. Some of the difficulties with delayed discharge, it varies across the county between different trusts. Now, I know I've said this before and it was mentioned slightly by Sean, but I do think the NHS has this bed-based mindset, and there's little mention of the fact that over 90% of hospital patients can be discharged to their own homes. They don't have to be put in beds somewhere else. The schemes we have in place, as Sean said, Home First, home assessments, are working well. But in addition to that, we're looking at a new innovative scheme whereby we can fund patients or their families so they can make their own arrangements for care at home for the weeks following discharge. It will be a grant at about the same level as direct payments, and we're working on that one, and we'll let you know how it goes. Tony Pounder's the one working on that one, for which I'm very grateful. Now, the other big part of our service in adult care is day services. Now, all the day services were closed in the first lockdown, and when they reopened, it was clear to staff that there had been a widespread decline in the service users. It also caused stress to the carers who had lost those precious hours during the day when they could look after their own needs, and that was gone. Now, with Herculean efforts by our property services department and transport departments, the service was reopened in the summer, but has now had to be severely restricted. All the elements involved in delivering the service, people, places, vehicles, etc., create risks of virus spread, and that's a risk we really cannot take at the moment. Now, overall, one thing is sure, things will never be the same after the pandemic. The way we work, the way we formulate policy, and the way we deliver our services will change. Now, during this, I've seen people I did not know emerge from departments I'd never heard of and make amazing contribution because they look at things through a different lens. We will certainly, I would say, see much more cognitive diversity when considering new policy operating delivery planning, and I think we'll be the better for it. Thank you, Chairman.
Chair, you're on mute.
I do apologise for that. Thank you very much, Graham. And Steve Holgate's got a question. Thank you.
Thank you, Chair. One comment and one question. The first comment is that I find it quite ironic, but also very refreshing that as a consequence of the dire straits that we found ourselves in, you know, the county council and the health service are actually breaking down some of the barriers and sort of restrictions and reluctance to work together in the way that that we've all been pushing and pressing for so many years, all of us for such a long time, having full and understanding that that in order to do so would be of huge benefit to both organisations. So those that's the positive that I see out of what is obviously a very negative situation that we're in. My question is about extra care units, something that we as a county council have been pushing and asking different organisations to develop. And it seems to me it's a bit of a different beast. It's not a care home because people are independently living. They all have their own front doors, so to speak, and cooking facilities and such like as that. But there are still significant areas of communal gathering places, particularly in some of the sections of the extra care units that are related to people with declining mental health capacity. I was wondering if the advice that we've been given to those organisations and those people who are running those extra care units differs from the advice we've been given to our own care homes and independent care homes. Thank you.
Graham.
Yeah, Steve, I think you may have found a hole in the advice there, because as you rightly say, these people are living independently, so they're not in residential care. So as far as care concerned, they're really in domiciliary care, but provided by on-site care organisations. And as you say, they do have communal areas and gyms and cafes and all the rest of it. So I think they would have to follow the advice of people living independently. Now, I know the food there, a lot of them get the food from the on-site caterers who will be able to deliver to their apartments as anywhere else. But I don't think we've actually specifically given advice directly to extra care facilities. And that's something I will have a look at to make sure we've got all those things covered. Thanks for the question. That's very helpful.
Thank you. Well, it looks as if Councillor Williamson hasn't been able to join us yet, because she did have an earlier meeting, and she was lately invited to this meeting. So we'll move on. But before I ask the Chief Executive to make a presentation, I'm just going to ask Stephen Young, because he's sitting there, if he's got any comments he wishes to make. Stephen Young is the Executive Director for Growth, Environment and other matters. Thank you.
Thank you, Chair. I mean, I suppose that just to reflect some of the comments that were made earlier in terms of the work that many people across the public sector are doing during this pandemic has been really incredible, and I really thank the members for noting that publicly. I mean, the Chief Executive is going to go through a presentation now that does cover a number of areas, and maybe if I could just keep my comments until she's completed that, and maybe support her around the questioning, that would be good. Thank you.
Okay, that'd be useful. Councillor Crompton, I see you got your hand up. You were to ask a question of who do you wish to ask the question of?
It was to Graham, actually.
Oh, right. So I didn't see it before I moved on. Thank you. Councillor Gooch so first of all, ask the question, and then we'll ask Councillor Gooch to respond. Thank you.
Yeah, it's just regarding the sheltered accommodation in housing associations. How they operate. Have we been in to see those, and are they vaccinated as well, the people in those?
Sheltered accommodation is a housing matter, and that's dealt with entirely by borough councils. It doesn't come under adult social care at all.
Yeah, Graham, I was thinking about the COVID side of it for injections, because a lot of people in sheltered accommodation are over 65.
You want Sean Turner for that one. I don't do vaccinations.
Okay.
Sean, can you throw any light on people in sheltered accommodation?
It was a quick slide off the shoulders, Graham.
Hello.
Getting the own back. Yeah.
Councillor Turner. No, not there. We'll try later.
Sorry, David. I'm just on the phone. It's a vaccine-related call. I'm just. Can I just come back in a minute? I just had to take it. It's quite important.
Come back after the Chief Executive made the presentation, because we're going to have to move on to that now.
Okay. Thank you, David.
Chief Executive Andrew Ridgewell, make a presentation, please, and we'll take questions later. Thank you. Microphone.
Can you hear me now?
Yes.
Thank you. So you will have seen the presentation which came out with the pack. I don't intend to go through that page by page. What I'll try and do is just to give members a quick overview and just bring a couple of items to life for you. In many ways, I mean, COVID is a fast-moving situation, and yet we have settled into a pattern of delivery now, which is still very much focused around the strategy that the LRF originally identified, which was very much about testing people, supporting those people of our population and our businesses to make the right decisions to keep themselves and other people safe, and then enforcement against those people who made poor decisions in those circumstances. That has always been our strategy, and that remains robust. More recently, of course, vaccination has come onto the strategy, and that is our top priority. However, the other three still remain incredibly important. The other thing I think that we just need to remember is that strategy remains robust, and it has done throughout the period of the crisis so far. But many of the levers and the environment in which we work are dictated by central government. So how we implement that strategy has had to ebb and flow around, shall we say, the very dynamic decision making of central government, and indeed any of the solutions that they've implemented nationally. So, for example, if you take things like testing, there are about 4 or 5 separate strands of testing, all of which are dictated by government and not all of which involve local authorities. An example of that would be, for example, testing in schools. So we remain wedded to our strategy, and the County Council has been a very big provider of the services to deliver that strategy. Within the County Council itself, our priority has always been, and it remains the priority, to protect our service users and our staff and to make sure we maximise the services that we provide, but we do that in a way that is safe. We've also, right at the start, we asked our staff wherever possible to work from home, and we also gave them assurances that if COVID impacted on them about their ability to do their job for whatever reason, they would remain financially secure. Those principles remain. We reviewed them in the current lockdown. We saw no need to change them. They remain equally important today as they did right at the start of COVID, because we cannot deliver our services without our workforce. And I thank members for recognising that, as you have done consistently throughout the whole process. Before Christmas, as well, as part of the Christmas process, we considered the absolute efforts that our staff have put in, and we did introduce a Christmas recognition scheme that awarded staff extra holiday, generally which we would expect them to take in the next financial year, because most of them haven't got the capacity to take the holiday now, and I'll pick up on that a bit later. And we also introduced the 12 days of Christmas, which we did in January, which was a prize draw which all staff were entered into. And that was really a very tangible thank you to the staff for what they have done so far. And for some, that's been at great personal cost. In terms of the delivery landscape for the council at the moment, we reopened most of our services, as you know. As we're in the current national lockdown, we have had to step back on some of our services, but far more services remain open now than did right at the start for the first national lockdown. Some services we've had to pull back significantly, so that would be around day services, that would be around libraries, that would be around registrars, a lot of these face-to-face services which we can't provide safely at the moment. Where we haven't had to stop those services, and our preference is not to stop those services, some of them will be delivered at a much slower pace, so our capacity to deliver is compromised. Part of that is down to the abstractions of staff. So since Christmas, we have started to see sickness absences rise again. So they started at the start of COVID, way back in March. We saw our sickness absence rising to about 11%. That dropped systematically across the year, but from December that started to rise on a regular basis. And at the moment we have about 7.75% of our staff who are on sick leave or unable to work as a result of COVID and normal sick leave that we would expect at this time of year. So we do have about a 2%, 2 or 3% increase in what we would normally expect to see at this time of year. That again means that that puts limitations on our ability to provide services. And if we see that we are running out of staff in critical services, such as our care services, we would look to redeploy staff again where we can safely do that. In terms of testing, and we have played a significant role in the testing strategy. Stephen Young and John Morrissey have been leading that. It is clunky when you're in a two-tier system, but we have worked really closely and really well with our districts to provide this targeted smart testing that we've talked about. The testing has been successful. Sean gave you some of the statistics around that. And what I would say is that it's been so successful. We have decided to ask if we can increase the military support. That's not because that hasn't delivered what we wanted it to deliver. It's because it's been successful. We think we can get more out of it if we get 2 more weeks with the military. And it's also worth noting that because of the success of our model, this is being taken up nationally, and now government are reaching into all large businesses, so those businesses with more than 250 staff, and looking for them to introduce that model directly in a contract with government. So that's a really positive reflection of what we've done. In terms of the vaccinations, we've been supporting our health colleagues on that. I think it's fair to say the standby list of people who get spare vaccinations is growing. Just about everyone thinks they should be on that list. So teachers are specifically excluded, but our transport staff who are transporting vulnerable older and younger people are included. Funeral directors are included. The list is growing, and I think most people could put in an argument, so that has to be very carefully managed. But the most important thing to note on vaccines is this is managed by the NHS. All we can do is make suggestions and seek to influence this. It's not our decision-making process. However, we have moved in and supported our NHS colleagues. In particular, we did for some of them take on the initial booking system through our call centre to make sure that people could get online and could book their appointments. And we're continuing to do that for the Lancashire Teaching Hospitals Foundation Trust as we speak. In terms of our oh gosh, can't read my writing, I'll skip over that one. In terms of our member briefings, we have increased the briefings. We hope members have seen that. So every time there has been a national decision, we've tried to introduce a bite-sized briefing at the end of the week and give all members access to information and the opportunity to ask questions. We do regularly, through the LRF, brief all leaders across Lancashire and all of our MPs. So we hope that you have noticed that we've increased that briefing. And in terms of the democratic process, that is just about up to speed, and we continue to do it all electronically. And I'm sure you will have your views about how successful that is. I don't think that's for me to comment on. Finally, in terms of our financial position, the County Council has washed its face with the resources that have been given to it. I think we collate regular expenditure for central government, and we are generally in the pack, so our costs seem to be consistent with other local authorities. I think it's fair to say for just about all local authorities, the costs haven't materialised quite as significantly as was anticipated at the start of the pandemic, so some of those costs are being revised down on a regular basis. We do remain worried about the medium-term financial position. We do see latency in demand for public services, which is going to have to be funded, and we do anticipate that public funding is going to be restricted as we nationally try and balance the books around the COVID and whatever fiscal decisions government might choose to make about the best financial response over the long term. Luckily for the County Council, we have good reserves, so compared to many other local authorities, we're in a strong position, and we certainly don't see ourselves having to make significant cuts in the immediate term, and we certainly won't be issuing any formal financial notices as we've seen some local authorities do. So I think the County Council continues to work hard. It continues to respond positively. It's making a lot of progress, some of which is nationally recognised. And I would just like to add to your thanks to our staff, because I think our staff, and indeed the people of Lancashire, have been really brilliant. And I will pause there, Chairman.
Thank you, Chief Executive. I have two people who've indicated they wish to speak. And of course, Erica was the first from some time ago. So, County Councillor Lewis, your question to the Chief Executive, please.
Thank you, Councillor O'Toole. Yeah, I wanted to just speak once in this discussion because I am aware that as a district council leader, I have other places to ask some of these questions, but I think to provide some information. But I wanted to start by adding my thanks to everybody else's. Council officers have been amazing throughout the pandemic, and the number of people who kind of stopped me on the street when I've left home to tell me about the experience they've had in dealing with councils and the support they've received is amazing. And I think we should be really proud of the work councils have done through the pandemic and the partnerships that have been built and developed and strengthened with community organisations, the NHS, Blue Lights, everybody who's been part of this. I did wonder whether the Chief Executive might say more about the increased staff absence numbers. I'm aware there's obviously a very logical explanation for that in terms of our staff being at risk from infection because of the work they do and because they are frontline staff. But I'm also aware that that's not the pattern in absences that all councils are seeing. And so just wonder if there's anything more that can be said about that. I wanted to come back to Councillor, I think it was Holgate's question about homeless folk and the vaccine. So the Secretary of State has given very clear directions to district councils that we should be working to ensure that all of our, in many of our districts, we've actually housed everybody. So people who've been newly housed are registered with GPs, and they should be getting their vaccine on exactly the same basis as anybody else. And for many of them, that will be because, very unfortunately, they will be clinically extremely vulnerable because of the health impacts of homelessness. I think I suspect that I was one of the councillors who was concerned about democratic involvement the last time this topic came to internal scrutiny. So I wanted to say I think the position has very much improved. And I think Professor Donna Hall wrote recently about the kind of challenge of managing command and control of civil contingencies responses and the democratic processes. I think Lancashire County Council was a bit slow, but I think it has improved a lot, and I'm delighted with the move to Teams. As somebody who hated the last IT system with something of a well-known passion, I am delighted with the move to Teams. The fact that I actually can get everything in my life on one device. And so I think that's, we're making good progress there. I still think there seems to be a lot of decision-making that has been taken out of more transparent democratic forums and moved away. And some of that will be because urgent responses are needed, but I think some of it's still because we're still trying to work through that balance. And I think there'll be further reflection on this because unfortunately, I think the climate emergency means that this probably isn't our last long-term civil contingencies event. So I think we do need to think about, and we will have got better because we've now practiced for a year, how we keep democratic things going alongside that command and control. Obviously, one of the places we do still appear to have challenges is with, it's got a special name, development control, and the fact that local councillors appear to be being told that they can no longer speak at those meetings, but can only provide a written statement. And obviously, that means you can't respond to anything else you've heard in the meeting that, does limit your ability to be involved. So I know we'll never get quite the same engagement virtually as we do have in the room, but I think wherever possible, we need to be looking to make sure those democratic processes are as robust as possible, even when they're done virtually. And then the last one, and it's great to have Stephen in the room for this, There's a lot of economic thinking and evaluation currently going on, linked to COVID and the Ministerial Task Force through the LEP across Lancashire for the Greater Lancashire Plan. And that economic recovery from COVID is going to be long and slow. And I'm wondering how we're looking to bring all this thinking together and where the spaces are for councillors to be involved in that forward thinking. Thank you very much.
Thank you. Before I bring you into the executive, I received a phone call yesterday from an irate gentleman representing apparently 6 parish councils in the Northwest, who was also concerned that he felt the democratic mandate was being reduced by not allowing councillors, elected councillors, to speak at development control meetings. Very concerned about that. So I just add that to Councillor Lewis's concern. So if you can answer the questions and comments of Councillor Lewis, I'd be grateful. Thank you.
Thank you very much. So I'll run through all of those. I'll probably invite Josh in to talk a little bit more about development control, which we do have some development control, but most of that, as we know, is done through the districts. And of course, I'll invite Stephen in to pick up at the end on the economic development side. And what Erica has done is reminded me that my note that I couldn't remember, which was MTF, was the Ministerial Task Force. So thank you for that. I'll pick up on that in a minute. So in terms of decision making, I mean, there's always the challenge to improve things and to make sure we're being as open and transparent as possible. We did publish all decisions taken under delegations so that they were there, which, you know, it is still after the fact. I fully appreciate that. We have no delegation, all the delegations that were given for the emergency have expired and they've not been renewed. So actually, as officers, we have no more delegations than we had pre-pandemic. So hopefully, if we still think there's some issues and maybe there's something slightly more fundamental that we want to look at, and we should seek to build that in moving forward. Perhaps that's something we can consider through the normal process of the Constitution, which will come up at annual council in May in any case, but we can pick that up through the democratic services. Looking at sickness, I haven't got details of information on a service by service basis, but certainly our frontline services are more deep. They always are, but we find those more impacted. And in our care services in particular, we are starting to come under some real strain now in terms of maintaining the workforce at an acceptable level. And that's not something we can sort of slow down or deliver more in a different way. So we are having some stresses and strains, particularly in our care services. But at the moment, we're recording absences for those who are self-isolating and not working, those who have a sickness absence due to COVID itself, other sicknesses, and employees who can't work because they have to have they're looking after dependents. We're also recording those people who are self-isolating, but many people can self-isolate and work at the same time. So that is the nature of what we're recording. We will have more detail about how it's impacting on services, but it is generally those frontline services where we're seeing the pressures building up. So I expect that to continue to rise, and I expect the abstractions, if we follow the caseloads, I might expect the abstractions to continue to rise until mid-February, and then we'd hope to start seeing it come down again. Last time it came down quite quickly, and actually we had some of our highest attendance rates just before Christmas. Anyhow, so the working from home is improving productivity in some cases. It's not brilliant for all cases, and certainly a mixed delivery model would be something we will be exploring going forward. Development control, I will ask Josh to comment on in a minute. I will just comment briefly on the Ministerial Task Force. Elected members may or may not recall that when we very briefly went into local authority level 3 before the previous national lockdown, we agreed with ministers that we would have a ministerial task force, which was to explore the impact of COVID on the Lancashire economy. And again, the impact of the levers that government gave us, the business grants, etc., to support the economy, with a view to influencing national policy going forward. We had our first meeting with Minister Scully, who's the Bayes Minister for Small Businesses, last month, and we are meeting him again on Monday. On the Monday meeting, we will be presenting the evidence of the impact on our economy, and probably we can share some. It might be worth doing a bite size, Stephen, for members, I think, maybe at the end of next week, about what that evidence has told us, because I think members will find that particularly fascinating. And the process that we've agreed is that we'll look at the evidence, which we've agreed with Whitehall officials, about the impact on Lancashire's economy. And then next month, we will be looking at what are the policy changes or the policy levers we would like to see introduced in order to help our economy grow in the coming months. This will be part of the levelling up agenda. I think we need to be very clear that the Minister won't do anything that is Lancashire specific. It's about influencing national policy levers. But we hope that in formulating this relationship and this foreknowledge of the policy levers, we're better placed to submit requests for funding which associate heavily with those policy levers and give us a greater chance of success. And we also would hope that that favourable relationship, would help our success going forward, because I think while there are decision-making processes, we should never underestimate the impact of having contacts in Westminster, and we should lever those as much as possible. But Stephen can give a little bit more information on that. So, Josh, do you just want to comment on the development control comment, and then we'll hand over to Stephen?
Thanks, Angie. Yes, happy to take that one. I suppose my answer is I agree with Councillor Lewis that wherever possible we should allow direct speaking. To be honest, the reason mainly why we moved to having written statements was connected to the limitations of Skype. However, it should always have been clear, and I'd make it very clear now, that county councillors do have the right to attend and speak at any committee meeting of the council with the permission of the committee itself. So I know the Development Control Committee itself did want to operate along some particular lines, but as we roll out teams to all our committees and development control, we should be able to touch wood, move to a position where members of the public, parish councillors, district councillors, and certainly absolutely county councillors will be able to speak and present at DC in line with the old rules that we always used to have about speaking. So we're working on it. I completely agree. It's not been ideal. We'll get there. Thank you.
Thank you very much.
Okay, I lost you for about 2 minutes there while Chief Executive was speaking, but as you can see, I'm back now. So I've actually got more speakers, but before I move on, more questions rather. Before I move on, Councillor Lewis, are you happy with the response you received?
Councillor O'Toole,
I think it was continuing.
Yeah, we're still waiting for Stephen to just come back on the economic development side of things.
Oh right, okay. Sorry about that. I lost you for 2 or 3 minutes.
Thank you, Chair. I mean, I think what I would say is, I think Erica Lewis is absolutely spot on with her comments. I mean, the impact on the Lancashire economy is unprecedented, as it's been throughout the UK and throughout the world. So we have seen a huge downturn, and that's manifested itself in a range of different ways across a range of different sectors. So in terms of beginning that sort of conversation with central government and with Lancashire businesses and Lancashire members, it's really quite a complex and multi-layered approach that we've taken on board. I mean, the Chief Executive Executive's already mentioned the ministerial task force, and that's going to be a key part of our process going forward. We've already submitted to the government our recovery plan, which we did several months ago, which talked around some industry or sector specific impacts at that particular time. We're having conversations regularly with senior civil servants. The Lancashire LEP is clearly important in terms of that conversation to get the voice from the private business sector. Got the all-party parliamentary group, which we've started, which again is a really powerful opportunity to have conversations directly into our MPs and directly into government. We're using the Northern Powerhouse, and we've got the Greater Lancashire Plan, and I'm sure there are others that I haven't mentioned yet. Now we're doing that as a Lancashire community, a Lancashire family. So we're speaking to our district colleagues, all our upper tier colleagues, and we're encouraging those organisations to engage with their members. We're trying to engage with our members. And through the LEP, we're getting the voices from the private sector, so we can get a really rich picture of what's actually happening. And through the various different channels that I've mentioned, we're able to speak to government repeatedly, remind them of the impact of COVID on Lancashire, and more importantly, also remind them that that we have a really rich policy and strategic framework in Lancashire. We are organised, we do know what we're doing, and we can deliver. And we're hoping through pulling all those different levers, we'll be able to access support from government, which I think will be absolutely essential to try and repair some of the damage to our economy. It would be foolish if we think we could do that on our own. Thank you, Chair.
Thanks, Stephen. You're happy, Councillor Lewis?
Yes, I think that was a very helpful response, and I think that the Chief Executive's suggestion of a bite-sized briefing on some of the economic stuff would be really useful, because it is complicated, and it's noted in one of those many economic things that I've recently been involved in, that because we are a polycentric county, and because we're quite different across the county, it's actually a real challenge to develop a kind of single economic narrative, and that's part of what we need to do. Oh, I've just had a thought about that. Okay, thank you very much.
Thank you. Yes, the bite-sized briefing last Friday was extremely useful. Unfortunately, we didn't get a huge attendance, but I would ask whips of all parties to encourage their members to go to those briefings. So last Friday's I thought was very, very useful indeed. Now, I've got Councillor Whip, Councillor Salter and Councillor Compton in that order. The reason your hands were lowered was once I'd advised you that I noted you, I lowered your hands, but I noticed you put them back up again. It just stops the number of hands showing on the screen, so I can keep control of what's happening. So Councillor Whip first, Councillor Salter, Councillor Compton, Councillor Whip.
Thank you, Chairman. I've got a cat lying on my county laptop keyboard, and I thought it might have caused the hand to go down. It seems to be behaving itself at the moment, though. Can I just pick up on the economic impacts, because we do have profound impacts through COVID-19. In my patch alone, there's well over 1,000 redundancies in bigger employers, but the smaller businesses, well, I mean, they're on life support. At best, they're treading water whilst they're unable to trade, but I think a lot of them are sinking, and I think one of the short-term issues in terms of response is to do with the support that's available for those businesses. I mean, often, one-person businesses, and they don't have the government grant schemes and the discretionary schemes that we have don't actually provide any realistic support to them, and they really are struggling. So I wonder whether that specific issue can be picked up and representations made through the ministerial task force, and I'm sure that those issues are already on the agenda because they affect us all. I wanted to ask about the democratic deficit, and one or two aspects of this has been picked up, but Josh referred there to all members of the county council being able to attend meetings of which they're not a member, but we've got this strange beast, the Outbreak Engagement Board, which is a subset, supposedly, of the Health and Wellbeing Board. It meets on a weekly basis, and in effect, it's giving a steer from elected members about the approach on different things, and it takes various reports about the situation and the like, and the access to that is non-existent for those people who are not a member of it. And this is an issue I raised at the last time we discussed this at internal scrutiny, and also I've raised it elsewhere. I do think that there needs to be some access for members who are not members of the administration. Those people who are keen to understand more and find out more should be able to access that Outbreak Engagement Board. So I'd welcome Andrew's comments about that. And then the second thing is what Angie's position is in terms of elections, because the joint returning officers did write to government about that. We've got county council elections, and though I'd ideally love to see the current administration kicked out of office, I increasingly of the view that it's untenable for us to campaign during the conditions that we currently have, which are likely to remain the same for some time yet. And although the county council doesn't directly administer elections because it's a district council function, the safety and the implausibility of actually providing elections on a traditional basis, it just seems to be something that's out of all conscience, really. But then I'd like to come back to lateral flow tests, if I might. And although some people will be aware of my views on lateral flow tests, where because they only pick up around about 50% of the positive cases of the people tested, it does miss 50% of positive cases. There is a big question mark about its accuracy in that respect, and the question about the false sense of security that might give. Are we assured that everybody getting a lateral flow test is aware that it does miss 50% of the positive cases, and people don't relax and then contribute towards further transmission of the virus? And taking that into account, could Angie expand on the extension of lateral flow testing from big workplaces to settings in which smaller workplaces, could be shop workers, could be solicitors, or small businesses that otherwise wouldn't be able to access those lateral flow tests? What arrangements have been put in place for those sorts of businesses, penny numbers of people, be able to access the rapid tests and those repeated tests, which at least give some prospect of some of those positive cases being picked up, and again slowing down the transmission? Thank you.
Thank you. Okay, who's going to respond to the questions from Councillor Webb?
Okay, shall I take them in order, and then I'll probably ask Stephen if he wants to comment on the lateral flow tests after I've done that, and Sean might want to comment on the LOEB, but I'm sure he'll raise his hand if he does. So starting with the LOEB, it's not just the administration, it's a subcommittee, as you know, the Health and Wellbeing Board, and it does include members from across the council and indeed district council representatives as well. The LOEB it's a difficult committee because its intent was about encouraging engagement for the public to follow the rules effectively, but it slightly morphed into a decision-making body, or not a decision-making body, a sounding board, I should say, for the government phoning us up and saying, what do you think should be the tiering system in Lancashire? So really it's slightly got misdirected, I think, in a fluid situation when we were trying to respond to very short-term government questions and to make sure that we got some degree of political influence and impression in that. And then actually more latterly we started to use to try and time the leaders and MPs meetings so we could get a broader sense of that and more representative. So I do believe that anyone can attend. It's really about the speaking which is restricted on that basis, but it is, I think, settling down now, and it's not really taking those sorts of decisions. So it's much more about, because government don't ask us now what we think about which tier we should be in. So it's moved on, and I think it is a different beast. But Josh will correct me, but I think any member can attend, but obviously it's only those members who are members of the committee who can speak. In terms of elections, firstly, to assure you, for the County Council, I am the returning officer, so it's me who gets thrown into the Tower of London if it goes wrong. And you will know that returning officer is one of those small areas where you can get called to personally account to Parliament, and you can get thrown in the Tower if it goes wrong. So please, please don't sabotage me on this one. Elections is really, really difficult. As returning officers, democracy is incredibly important, and that's about getting people out to vote as much as possible. It's about giving politicians the opportunity to do their campaigning as fully as they possibly can. So managing the elections is a fundamental of local government and something that we hold in very high importance. But in this situation, the elections are incredibly difficult. Just simply creating a safe environment where people can come and vote is going to be difficult. And staffing it is incredibly difficult because a lot of the people who staff are old, possibly vulnerable. So we will need more staff. We're probably going to have less staff. The flow will be slower. And indeed, just basic questions like, do we have to have a separate pencil for every single person who comes in? So arranging the elections is going to take an incredible amount of work, just the physical logistics of the elections, and the restraints on campaigning will make it very difficult for politicians. We will do whatever needs to be done. We're committed to delivering the elections, but what as returning officers we absolutely want to avoid is the government waiting till the last moment when we've deployed shed loads of resources which could be fighting the virus, if they cancel the elections right at the last moment. So we did make representations to government, and that was really about teasing out from them a commitment that they can stick to about they're going ahead or they're not going ahead. I did see something, a news flash last night, that I think they've committed that the elections are going ahead, but it was one of those flashes across the screen and I haven't had a chance to chase it up. But I think we have to declare the election, or the formal notifications for the elections is something like the 26th or 28th of March. That really is the last date that they can be cancelled. But at the moment, my understanding is that they will go ahead. But as returning officers, we are very concerned that we can't do these safely, and it's going to take an awful lot of time and money and indemnity. And then finally, in terms of the lateral flow tests, yes, the accuracy issue remains. I rather rely on hearsay from Zachary rather than my own personal knowledge, so call me out if I've got it wrong. But the lateral flow tests are designed to have regular concurrent tests. So one test is dubious in terms of its accuracy, but then if you take the test every 3 to 4 days, you can start to build up confidence in it. And indeed, the testing model that we have rolled out, by training the trainers in employers, in big employments, they can undertake those tests on a regular basis. They can build up that degree of confidence. Working with smaller businesses is problematic. But we're starting now to look at how we can do more of this in the community. So we still get a targeted population, a high risk that we're testing, but we can get that throughput and that regularity. That's going to be more difficult, but now we've got a system in place for the larger businesses. We can start looking at how we can engage with the smaller businesses. But Stephen, you might want to elaborate on that a bit more.
Okay, just before we move on to Stephen, I've now got 1, 2, 3, 4, 5, 6, 7 people wanting to speak. So can we try and keep these concise as possible, please? And that applies to questions as well as answers. Thank you. Steve.
Okay, on the lateral flow comment and point, I mean, I think County Council Whip's right. You know, there is no gold standard, whether it be the lateral flow test or it be the PCR test. I think the point that the Chief Executive made was absolutely right. I think multiple tests really do reduce the likelihood of consistent and repeated negative tests. I'm told from the latest statistics that I've seen, there's 27,000 people in the UK who've been told to self-isolate as a result of positive lateral flow tests that wouldn't have otherwise self-isolated. So, you know, obviously you could come to a view as to whether 27,000 people that have self-isolated as a result of that test is a good thing against a population of 60 odd million. But obviously that's the debate for other people to have. I think in terms of that, the questions asked around the lateral flow tests around how we would move outside of large employers to smaller employers. Clearly we went for the large employers first because you can get more bang for your buck. And we are, as we go around large employers, we're attempting to train those employers to be self-sufficient and do the tests for themselves. And then we look to move towards smaller companies and sort of work your way down the food chain, as it was. We're also mindful as well to try and make it available for members of the public, but obviously it's very resource intensive to try and increase the footprint that you're testing on. So obviously everything's dependent on resources, but that ultimately is the end game that we'd like to get to. Thank you, Chair.
Okay, so although I've got Councillors Salter, Compton and Holgate who want to ask questions, also during that response from the Chief Executive, Sean Turner's name was mentioned and Keith Iddens put his hand up and so has Josh. So I presume those three are all on the questions from Councillor Whip. So we'll deal with those as quickly as possible, please.
Okay, Chair, on me first. Yeah. Okay, you know, just briefly, Angie mentioned my name, so I thought it'd be cheeky not to come in. I think she described it just about right, being the engagement board, Outbreak Engagement Board being a sounding board. And even then, it's you know, evidence that it's not always listened to by government anyway. But yeah, I think people can attend, and I would say that, you know, of the membership, we'd all be happy to take any issues that need to be raised from members. That's absolutely fine by me. But yeah, that's all I really wanted to say. It's not meant to exclude anybody. In fact, there's been several meetings we've had over time where it's involved you know, wider sort of stakeholders that we've actually invited them in and actually brought them into the debate in terms of district councils, etc. So yeah, it's obviously we didn't ever want it to be unwieldy, but it has evolved as this has gone along. But certainly I'm happy to take things through if members want to raise them with me. Thank you.
Thank you very much. Keith Idden.
Thank you, Chairman. It's just to point out to Councillor Whipper, obviously I do agree businesses are very, very important and we need to support them all we can. And obviously the leader and Chief Executive are busy doing this. The leader at this minute is in meetings with ministers and we will do our best for Lancashire. And as Stephen pointed out, we have a good framework and I'm sure we will succeed. But could I just point out that districts were given sums of money to support businesses, and not all this money has been spent. And I think that if you are with a council that hasn't spent any of this money, some have spent the full 100%, but a lot haven't, and there's still a considerable sum of money in there that can help businesses along. So if obviously you know that for some reason it hasn't been spent, if you could push it along, that would be super. Thank you.
Thank you very much for that. So we can go, Josh has withdrawn the request to speak, so we go to Matthew Salter.
Thank you, Chairman. I am interested in part of the presentation that we were able to look at ahead of time. In particular, it referred to the financial outlook of the County Council, and it does seem that we're in a sort of strong and sustainable financial position, which is I think encouraging, and you know, given the challenges that we've been facing. But I was wondering, given that we've sort of been given that message, if there's any benchmarking available, or any sort of any more detail that we could be given to sort of grasp the comparison with other comparable councils, to sort of appreciate the ultimate financial position at this point.
Right.
Thank you.
Yeah.
Sorry, just very briefly, thank you, Councillor Salter. So I have asked for some information, just an update about where the County Council sits vis-a-vis other authorities. So I know I can definitely get some comparisons with other county councils, might be able to get some broader comparisons. I haven't got that information, but I'm quite happy to share it with the committee when I have it available. Thank you.
Thank you for that. Councillor Compton.
Yeah, thank you, Chair. My question's for the Chief Executive. Angie, when you was rhyming off the list of why people aren't in work, you give us a whole raft of them, but I don't know, I can't remember whether you gave us any actual figures of how many people are off sick or a percentage. I might have missed it, but I can't really recollect any figures being mentioned of how many people out of the County Council are actually off sick, sorry. Thank you.
Chairman, so at this point in time, we have about 7.75% of staff off sick. So if we've got, let's just, our workforce is about 10,000 people. So that would be, oh no, because I'm an accountant now. It would be a proportion of that. 700. That seems low, actually. Well, up when it. Yeah.
750, isn't it?
Yeah, that just feels a bit low, but it's certainly 7.75% abstractions. Of course, other people will be off for holidays and because they're able to be, or if they have special leave and so on and so forth. But this is sick leave.
I would have thought it's changing almost daily, the situation. Yeah. That's the problem. Okay, Councillor Holgate.
Thank you, Chairman. I'd just like to come back to the issue of elections, and David and Angie spoke about their concerns, and I share those concerns. Doing this job safely is going to be a heck of a task, one that I think we need to press on with nonetheless. But just an observation, must have been 10 or 12 years ago, Chorley Council and various councils across the country engaged in a pilot scheme promoted by the government in going about using all-out postal votes. And whilst I recognise that it's probably too late to move to that idea for the May elections, I think if we're trying to influence government in terms of policy, then I think it's something that should be looked at again. I'm sure we're not going to be as prone to the fraudulent activities that Mr. Trump suggests might have happened in America, but there probably are ways in which, you know, tightening up on postal vote security could be done, and it seems to me to be a sensible way forward. Thank you. Stephen,
one of the problems with postal votes at the moment is the mail. I don't know whether you were in the beginning of the conversation when I told Erica Lewis and myself had a conversation about postal votes. Ormskirk Sorting Centre is decimated, 70 people with COVID. I haven't received any mail. This is the third week I haven't received anything, including the papers for today's meeting. That's why I'm using 2 computers. And I think, from what I understand, one chap that went to the sorting office to collect his mail wasn't welcome. And he said to me that there was mail and parcels strewn all over the floor and the whole place was in chaos. So I think it's going to take some time before we get back to something normal within the postal service. I don't know whether you want to add anything, Hansie.
No, but I just agree with the principle.
Okay, thank you. Okay, so Erica, next.
Sorry, I just very quickly wanted to come back on Councillor Eden's slightly odd comment about district councils and economic support. It's not that district councils are sitting on this. One of my colleagues on the LGA Resources Board did a count, and their council was trying to administer 18 different business support programs, because it is incredibly complex at this point, because I think they were from Milton Keynes, and so they'd been in tier 4 for 3 days before lockdown had happened. And so there was this moment where, because some of these grants stop and start as you change tiers or go into lockdown, there are multiple schemes. So it's incredibly difficult for businesses to know what to apply for. And it's incredibly difficult for the officers who are trying to administer these schemes. And I know and every time officers have to kind of redirect applications and support businesses to make different applications, because often the government requires different information for different schemes to be collected. So while we are trying to do everything we can, I would confidently say every district council in Lancashire is doing its utmost to distribute as much money as possible to local businesses. It's just not in our interest to hand it back to Whitehall. We want it distributed to local businesses, and we want it in Lancashire pockets. And so I don't think anybody needs prompting by their county councillors to get on this. They are all desperately working to do this as fast as possible.
Thank you for that.
I do take your point. Thank you, Chairman. I do take your point, Erica. I was just giving everybody a little gentle reminder, but there is some funds there, and obviously we need to get them out. That's all it was. Thank you.
Thank you.
Okay. Well, I'm glad to say that County Councillor Philippa Williamson was able to join us about half an hour ago. I know she had another meeting. I'm going to ask her to speak in a few moments. Before I do that, thank the Chief Executive and Stephen Young for their contribution today. Please stay on, obviously, until we get over this particular item. And Councillor Williamson, what's happened with the other portfolios? They gave us a brief update on the position of their departments, and then they answered questions. By the way, members, questions are not obligatory. So, Councillor Williamson.
Thank you, Chair. Sorry I wasn't able to be here from the start, but I know that members have had the opportunity to have a quite detailed update from Edwina Grant and her team at the Education and Children's Scrutiny Committee already. So that was a very engaging and lengthy discussion. So a lot of the information that people was burning in people's minds will have been addressed then. But broadly, things in my portfolio area are going. I have to say the officers have done a marvellous job and going particularly well. On the children's services side, we've heard some interesting comments about sick leave and staff attendance. incredibly, this more flexible way of working has really been taken on board and absorbed and worked well for a lot of our frontline social work staff. For some of our newbie social workers, it's been quite difficult. They need that sort of regular contact and support, because it's quite difficult out there working with families in this very new way. But for others, it has really been taken on, and the sickness levels have been amazingly low, which is a great credit to them, and gives us a lot to think about the way we organise the service going forward. Obviously, on the children's side, the whole of the COVID situation in terms of safeguarding brings with it its challenges, but that's been going as well as it can do. We have upcoming an Ofsted review of our approach to dealing with all things COVID, and the service have been putting together their thoughts on all of that, and there are always areas that we could do better, but generally we feel as if they've done a fantastic job and made sure that our most vulnerable children and young people are safe. On the education side, things are challenging, as we all know, but again, the teams are working really well. And we're giving as much support as we possibly can to our 628 schools, and the teachers and the staff and the governing bodies who are working very hard to keep the schools open for the most vulnerable and children of critical workers. So everyone's doing working the socks off, frankly, in what can be a very difficult situation. I'm happy to take questions, but I know that you've all had, and I know a lot of you were at those meetings, have had an update on the stuff from Edwina and Sarah Callahan and Sharon Hubbard directly. Thank you.
Thank you, Philippa. I noticed a note from Ms. Bard to Carl. Was that subsequent to his question, or is something else he wanted?
No, Chair, I wanted to come in before Philippa spoke, actually.
Oh, right.
It was a reply to the question that I asked, and Graham batted it over to Sean.
Right.
I just wanted to know if Sean could answer me on the question that I asked, that's all, but I can wait till the end if you want.
No, just remind him now, and then we'll move on back to Philip's questions. Could you just remind Sean what the question was?
Yeah, Chair, it was regarding RSLs and the sheltered accommodation that they have.
Oh yes, of course.
Facilities on the vaccination and how we look after those sort of people.
Okay. Sean, have you got anything on sheltered accommodation and RSLs?
I had Carl and Chair. Sorry about before. I had a phone call about vaccinations. It was actually a victim of their own success, in that it was a primary care network that I'll blame Keith, because he contacted me about it yesterday. They rang me then. I took the call, and basically they've actually come to the end of their top 4 priority groups, and are looking for potential key workers working within our authority. So anyway, I've dealt with that, so I apologise. I missed that question at the time. I just heard somebody calling my name while I was on the phone. Carl, can I come back to you with the information on that? I know there is stuff going on around that, and in particular frontline staff. I know that visit people in homes as well. So I'd be happy to come back to you on that, Carl, if I can.
No problem at all, Sean.
Thank you.
So anybody have a question for Philippa? No? Okay, well, that's good. We'll move on shortly. But first of all, I'd like to thank everybody that's contributed to the COVID response from Lancashire County Council item this morning. It's been extremely useful. The presenters and the questioners, I think we covered all the ground that was necessary, and there will be one or two answers which will be sent to individual members at a later date. So thank you for that. The recommendation is that we note the Lancashire County Council update to COVID, and I move that recommendation. Somebody second it?
Can I second it, Mr. Chairman?
I'll second it, Chairman.
Very much. Okay, well, that's great. And those members of the Cabinet and other contributors, if they want to leave, obviously they can do. If they want to stay to see what the next item is, very exciting, future planning, you're welcome to do so. They're disappearing, some of them already. I've said something to upset.
Thank you, Mr. Chairman. I can't stand the excitement. I shall leave.
No, leave it.
Yeah. Likewise, Mr. Chairman.
All right.
Yes.
In that case, when I get the screen going properly again, we move on to the next item, which is item number 5, overview of scrutiny work programme 2020-21. Now, we, by necessity, had to more or less ditch the work programme that was planned, as you know, by having 1 or 2 urgent items. The last one was to do with speeding in the county, and that was very well received by members of the public who contacted me, and also by members who took part. And hopefully we're going to see some action as a result of that, because we did get the message out to highways and hopefully to the police that there was great concern. The outcome was that Councillor Idden has ordered 4 very large mobile units for various parts of the county. They'll tour the county, but of course apparently they had to be made, and they're still not with us yet. Well, they weren't last week when I asked about them. I should have asked them before he disappeared if they were ready yet, but they will have some impact. I also got some information from the police regarding the number of speeding offences that have been over the last couple of years. Unfortunately, I would have preferred it during this lockdown situation, but 350,000 apparently tickets have been issued, and just not in my own division, but in West Lancashire North, just one short stretch from Southport to Tarleton traffic lights on that bypass, they issued about 30,000 over a 4-month period. So they are taking action. The problem, I think, that I got from councillors, and certainly from my own knowledge, is they're not actually covering the roads that we have in our more residential areas. But that's something which I just thought I'd mention as a result of that meeting. So the work programme, we're just really looking for some ideas for the work programme, and there's no need to be decided upon now. I'd be very grateful if councillors could email Miss Barr or myself with suggestions for the work programme, and particularly for the March meeting. So unless there's anything to say, please do so now. I'm just trying to see what Miss Barr said. Oh, she's just commenting something.
Chair, we have a request to speak from County Councillor Lewis and
Yeah.
County Councillor Rigby.
My screen's gone blank again. Just hold on, I'm trying to rejoin. That's it, it's come back again. It just disappeared. So Councillor Lewis and Councillor Rigby. Yeah, Councillor.
Thank you, Councillor O'Toole. I came with a couple of suggestions. I wanted to come back to the kind of question about recovery. I know I asked specifically about economic, but there's also kind of social aspects to that as well. And I wondered if that might be an interesting topic for discussion, obviously, both in terms of understanding how the county is kind of looking forwards to that, but also as we kind of move, as more people get vaccinated and we move more to recovery work, kind of monitoring around that. But I wondered if a kind of initial discussion to scope some of that might be useful.
So would that be, how is the county council planning for recovery?
Yes, I think so.
Along those lines, what plans are in place for recovery?
And how are we engaging? Because it'll have to be a kind of shared effort across districts and the LEP and community organisations and major institutions and all of that. So I think that kind of how are we working with others as well, and that is important.
Okay. I'm making a note of that. Good.
Yep. Thank you. In that moment of being inordinately proud of the work that officers have done through the pandemic, and not wanting to stray into operational matters, so happy to take officers' advice and guidance on this. But I did wonder whether we should have a thought about, or at least have some information about the kind of broader discussions about welfare and well-being of our staff, and how we're supporting them. And I guess the bit of that conversation I'm always really interested in is how, as a councillor, can I better support officers and work more productively with officers. And then the last one, there was a, obviously we're about 12 months since, is to kind of get an update on how the county is going in terms of meeting its carbon targets. And there was obviously a relevant unanimous, I think, resolution about kind of broader climate emergency environmental planning. And I wondered whether it would be useful to kind of compile that into a review as well. So those were my 3 suggestions.
Okay, thank you very much for that. Councillor Rigby.
Thank you, Mr. Chairman. Yes, I'd like something to come to the Scrutiny Committee about drainage, highway drainage, drainage in general, about how the department is performing. And I'm not saying it's to come in, you know, next month or anything like that, but I think the council should have some sort of policy on drainage. We have been handed the drainage mandate, as it were, from central government, and I think it's something that we need, you know, physical more presence about. So I'll leave it at that. Thank you, Mr. Chairman.
Well, in my discussions earlier in the week with Ms. Barrett and others, I mentioned flooding because, of course, it's very topical at the moment. But I was reminded quite clearly that we've already got flooding with the External Scrutiny Committee, and that there is a task group looking at that. Now, it might well be something they're looking at. I don't know, because I'm not have much knowledge about what they've been doing about it yet. But I could take it up with County Councillor Nash, who's chairing that External Scrutiny Committee, to see if drainage is included in the discussions regarding flooding and the problems that we're facing right across Lancashire at this time and previously, of course. So, is your question about drainage to do with local flooding?
Well, it's to do with the effectiveness of how it's set up within the county council, and the effectiveness of the department. And if that isn't internal scrutiny, I don't know what is. It will go across both committees. I can accept that, but I try to contact the department quite a bit, and I, you know, have problems in my areas. I know everybody has problems in their areas, but I do think the internal scrutiny should be looking at the effectiveness of the department.
Okay, that's a good point. Thank you for that. Right. So we've got some ideas there. Thank you for those ideas. We'll discuss them. Matthew, you've got your hand up. So.
Thank you, Chairman. I just wanted to come in on the flooding point. I think to say a couple of things. So one is there was an external scrutiny committee task and finish group that looked at flooding. That produced its report and has disbanded. So that isn't sort of ongoing in that sense. I think in terms of Councillor Rigby's concerns, we certainly have looked at, say, the gully cleaning procedures with this committee before, and there's some of the some of the policies with flooding and some of the work is done directly by highways. So that is very obviously sort of, I suppose, our bread and butter. But I agree that, you know, clearly if we wanted to, as a committee, have a one-off look, there are certainly issues within flooding that we could look at, but we could perhaps, with a focus on highways, look at that issue if that was of interest to the committee.
Okay, thank you for that comment. Councillor Whip, I notice you with your hand up.
Yes, Chairman. You've got several members of this committee that served on the task group looking at flooding, and besides Councillor Salter and Councillor Lewis, I think Councillor Rigby, I was one. And one of the recommendations from that task force was indeed for internal scrutiny to look at those internal parts of the county council that were involved with both the highway drainage and indeed the flood lead local flood authority work. So I think it would be eminently appropriate for us to actually pick up that recommendation and run with it.
Okay, Councillor, thank you for that. I'm making a note of that as well. Good. So we've got quite a few topics there. We also got that business of flooding, which is very topical. And that's one of the reasons, of course, we've messed about with the work programme, because some of the items weren't as urgent all of a sudden due to the current situation and the ever-changing situation. And who'd have thought we'd have had all that rain in the middle of this pandemic? It's not helped the situation at all. You only to see nightly on Northwest Tonight on BBC the state of the northwest of England. It's shocking in many parts, including a lot of my own division, which is low-lying, particularly that goes across the Moss towards the coast there. It's really bad. So thank you for that and those suggestions. So we'll take those on board. The next item is urgent business. I have no urgent business. The date of the next meeting is the 5th of March, 10 a.m. as usual. I think it's been a useful meeting. And I'm really grateful to you all for the contributions and the way they were delivered. So thank you very much indeed. And Miss Bart, if you could stay on at the end for me to have a few words with you about what we're going to do about some of the suggestions. Thank you.
Thank you, Mr. Chairman. Well done.
Thank you.
Yeah, thank you, Mr. Chairman.
Bye.
Thank you, Chairman.
Bye. Bye.